Thank you again, Cinde Warmington, is candidate for governor, current executive counselor. And I want to start with kind of a general point. So you and your primary opponent are hitting a lot of the same notes in your campaigns and addressing a lot of the same topics. So why should voters choose you specifically?
Sure. Well, as you all know, I've been the executive counselor for the past 4 years and representing Cheshire County as well now as Grafton County. Before that, my district extended from Keene, Concord, all the way over to the seacoast, Durham and Dover. So I have represented 97 cities and towns in our state, all across the state, 8 out of our 10 counties. So I really know the issues on a statewide level. I know the issues in Cheshire County of broadband, of flooding, farmers that we've been dealing with. I know the issues in the North Country, emergency medical services, again, broadband up there, the concerns regarding the timber industry. I know the issues on the seacoast. So I really know all of the issues all across our state. And have been dealing with those at a pretty close level with the cities and towns all across our state for years now. In addition to that, my work is in the State House, and being on the Executive Council is kind of like 4 years of on-the-job training to be governor. We see everything in the executive branch, see what's working, see what's not working, and have the opportunity to work with every single commissioner in our state government. I know how things work in the State House. I work with the legislature, I work with the governor's office, I work with the executive council. And again, I work with every single commissioner. And that is particularly important because these commissioners will all stay in their positions after the election. And, I have literally been working with these folks for years. They know me. They know they can trust me to not mislead them. They can trust me not to embarrass them at a council meeting or try to ambush them, but work hand in hand with them for the benefit of the people of our state. And I think they will continue to work hand in hand with me as executive counselor. And maybe most importantly is that I have been the one on the executive council standing up for the issues that are most important to the granite staters. All across the state, we're hearing about reproductive freedom. That is a critically important issue in our state, about public education, about affordable housing, the cost of childcare, the cost of energy, and the property taxes. And I have been the one on the front line going toe-to-toe as the only Democrat on the executive council with Governor Sununu for literally years now. In fact, I am the only person in the state of New Hampshire who ever goes toe-to-toe with Governor Sununu. And it happens every single week, 2 weeks at an executive council meeting. And I think that's pretty good training for going toe-to-toe with Kelly Ayotte on the debate stage come the fall. The Republicans have made it clear that I am the candidate they do not want to run against. And Governor Sununu himself has said that I would be, when asked about this primary, has said that I would be formidable. And I am ready to take on this challenge and believe I am the most qualified one to do that. Just one more thing though, my experience on the executive council is from a minority of one. And from that minority, I have been extremely effective in representing my cities and towns, including all of those in Cheshire County, and getting things done for the people of our state, despite being in a minority. And what that means is that I have not only been able to stand our ground when necessary, but also been able to reach across that table and find the common ground and make things happen for the people of our state.
Okay. So for decades, the first question any gubernatorial candidate in New Hampshire gets asked is, will you take the pledge? And that may not be as big a deal as it had been in the past to answer, but certainly the governor's approach to tax structure is very important to Granite Staters. So what's your take on the state's tax structure and revenue streams, and what, if anything, would you change?
So as I travel across the state, and of course in my role as executive counselor, I'm acutely aware of how difficult it has become for working families in our state to make ends meet. And as I mentioned, the cost of housing, the cost of childcare, the cost of energy, and the cost of property taxes. And the last thing that working families need right now is an additional tax burden on them. I have taken the pledge to veto any broad-based sales or income tax that comes to my desk. And I am committed to making sure that we stop the downshifting to communities so that communities can actually get property tax relief. I think that communities are seeing their taxes go up and up. And for so many people, especially people on fixed incomes, it's getting harder and harder for them to maintain their homes in their communities. We have to stop downshifting to our communities and build the budget that is from the ground up, a responsible budget that reflects our priorities. I have actually already been involved with that. I have been working with state and House and Senate leadership on what a budget reflecting our priorities will look like, because the budgeting process has already started. So I can't wait until I'm elected. I need to make sure that we're looking at a budget that's going to reflect the priorities of working families in our state.
So one of the big issues that kind of crosses over from budgeting to education it is school funding. So the state is again defending itself against lawsuits over how much it pays to fund education. And as governor, how would you propose that we get past that?
Right. So let me start with my commitment to public education. I was the first person in my family to ever go to college. I had to work my way through. I worked 30 hours a week all through college. I know the value of a public education. I will come to this issue as someone who really wouldn't be here today if not for a public education. And it is the bedrock of our democracy. It is what gives every single kid their shot at the future. And I am committed to making sure we protect it for future generations. Right now, we have a real assault on public education going on in our state with our Commissioner of Education, Frank Edelblut, who simply does not believe in public education and is diverting public dollars away from our public schools and into private organizations. And I believe that taxpayer dollars should be spent in our public schools. And so that would be on day one, I would start the effort to reverse this dangerous voucher scheme that is undermining our schools and make sure that taxpayer dollars are going to our public schools. And when just in terms of dollar amounts, when that program was first sold to the legislature, it was sold as something that would cost the state about $130,000. We're now over 30 million, and predictions are looking at 60 million for next year. So those dollars need to come back into our public schools. With respect to the lawsuits that you are talking about, I want to say this. Anyone who tells you they have the solution to school funding in our state is not telling the truth. No one has the solution right now. But I know what the next step is, and that is we need to bring a bipartisan group of stakeholders around the table to actually sit down and solve this problem. That hasn't been done. That has to be done with the leadership of the governor's office. This administration has chosen instead, as you noted, to appeal the school funding lawsuits to the Supreme Court. So really what that accomplishes, it ensures that this kind of bipartisan discussion that we need to happen isn't going to happen while those cases are pending. So this was really a kick the can down the road to the next administration. And we will be ready in my administration to actually tackle the problem, to sit people down, to find the bipartisan solutions that we have been avoiding for way too long.
So when you say that you would, on day one, start to address getting rid of the school voucher program, so that was enacted by the legislature. What would your approach be? How would you try to undo that?
First, by educating the public about what this voucher scheme really is. During my term as executive council, I wrote an op-ed about education funding. I think it was published in the Keene Sentinel. And I have continued throughout my terms to educate people about how dangerous this voucher scheme really is in terms of dismantling our public schools. What happens in this scheme is that more and more taxpayer dollars get siphoned away from our public schools. Our public schools continue to have fixed costs. Those costs end up being funded by the property taxpayers. The property taxes go up to the point that the communities say they can no longer afford this, and then you're left with just a voucher program and no public schools. That is ultimately the scheme that is currently in place. So the first thing we need to do as governor is make sure that we educate the public about what is really going on here, that this program is nothing but a subsidy for private schools. It is taking money away from providing public education, and it is taking away from making sure that we have public education for future generations. So we need to work collaboratively with our legislators, but also making sure that the public understands what this program really is. They have successfully labeled this as a freedom in the state, that parental freedom, they have characterized it in that way, but really this is a program that fundamentally undermines public education for the future.
But if your approach is to try to get the public to understand what the downsides of this program are, suppose you're successful in that, then it would still be like your entire term before the public, knowing that, could take any action, right?
Well, it may or may not happen on day one, but we are, as I said, part of the hallmark of my time on the council is not only being able to stand my ground, but also being able to find the common ground, reach across that table and find the common ground and talk to people that I disagree with. And that is part of this whole discussion, is that we really need that's how you get things done in Concord. We are a very purple state, and we are only going to get things done when we talk to each other. And that is part of this discussion, but we really need to be having this discussion. The governor needs to be leading on this issue, and I will be leading on this issue.
Okay, you mentioned that that program being posited as a parental freedom issue. So there have been a number of initiatives put forth under the umbrella of parental rights in education in New Hampshire in the past several years. And certainly parents' rights should be, taken seriously. So how do you balance the parental rights issues with letting teachers and schools do their jobs unimpeded?
Sure. So just with respect to let's start with the voucher program, is that I am 100% supportive that every parent can make the decisions that they need to make for their children, but not by diverting taxpayer dollars away from our public schools and to private organizations. I also should say that one of the key issues that we need to address right away is that we need to appoint a commissioner of education who actually believes in public education, supports public education, and supports teachers. And some of the things that we're seeing right now is the things that you're referring to around freedom in our school are really being promulgated in a way that is incredibly disrespectful to our teachers and to the work that they are doing in our schools. These efforts to ban books, to limit what teachers can teach. Teachers should be able to teach the truth about our history. The divisive concepts that have been put forth and then rejected by the courts are an effort to limit the ability of teachers to teach. We don't need that in our schools. We have to respect our teachers and their right to teach the truth to our students.
Is it my turn, Bill?
Yes, go right ahead.
Okay. Didn't know if you had a follow-up there.
No.
Cindy, I was reviewing your website, and one of the major parts of your platform is repealing the state's abortion ban. And I'm wondering, what does that look like specifically?
So I was early on in my term, I had called out the governor on this abortion ban. Initially, the ban even contained no exception for fatal fetal anomalies, and it required actually transvaginal ultrasounds to determine the state of the pregnancy. I called out the governor on that, and we were able to successfully put enough political pressure on to make those changes, but this ban remains a danger to the women of our state, and it needs to be repealed. And after Roe v. Wade fell, the governor announced at a council meeting that nothing had changed in New Hampshire. And I had to remind him that while I understood that for him personally, nothing had changed, but for half the population, something very, very big has changed. Women freedom, reproductive freedom is the beginning of freedom for women. Women only have freedom if they can plan and prevent and space their own pregnancies. And we are absolutely going to repeal this abortion ban and replace it with protections to access safe and legal abortion in our state. We are the only state in New England that doesn't have such protections enshrined in our laws. And we are going to replace this ban with protections to access safe and legal abortion in our state. We trust women to make their own reproductive healthcare decisions without government interference. And that is fundamental to freedom.
Okay, so I'm hearing no restrictions, right?
But exactly, we will trust women and to make these decisions with their healthcare providers, as they had done for many, many years after Roe v. Wade was decided in this state, until recently when Governor Sununu enacted his abortion ban.
And again, that was actually enacted by the legislature. The governor did sign it. Now that it is law, how would you go about trying to undo it?
Well, the first thing we're going to do is we expect we're going to have a majority in the State House that will do this. And we are going to make sure that, more than almost 80% of the people in our state believe that women should be trusted to make their own reproductive health care decisions. So we're going to have a law that reflects the will of the people in our state, and we're going to have a governor that leads on that issue.
Okay. sticking with medical themes, many areas of the state, including this one, have a real lack of medical options, medical care options. And I'm wondering, what can the state do to attract more providers?
So thank you. You may know that I spent decades in healthcare. My undergraduate degree is in medical technology, and my first job out of college was as a laboratory technologist at Lakes Region General Hospital. I worked in hospitals and healthcare for 20 years before I went to law school, and then became a healthcare attorney and worked in that area until I was elected to the executive council. So this is a very, very near and dear to my heart. In fact, the whole reason I got involved in politics in the first place was to provide universal access to healthcare for everyone. Now, around workforce in particular, there are a number of things that we need to be doing. We need to be looking, and particularly for the rural areas, we need to be looking at the fundamental things that are preventing healthcare providers from hiring workers now. And what healthcare providers are telling me is that they can't hire because the people can't find or afford housing. And childcare is also a huge issue. So we fundamentally need to be addressing that, which is affecting not only healthcare, but all of our sectors. We need to make sure that we have cut through the red tape. One of the frustrations that healthcare providers have is that when they have someone who applies and they have to go through background checks, that there's a lot of red tape and been a lot of delays in that. That actually came up during my first term, where I encountered someone who had been waiting literally for months, had a job offer as a physical therapist at a hospital and was waiting literally months for the background check to be completed. And when I looked into that, I found out that not only was that person's background check being held up, but there was a huge list of thousands of people who were waiting to be approved because we had a delay in the fingerprinting process. So we dug in on that, really, got to work on that, and were able to reduce or almost, I guess, eliminate that backlog so that we could make sure we were processing folks more expeditiously. So we need to make sure that we've cut through the red tape. Student loan repayment funding, particularly some specific areas that we can focus in on, particularly for rural areas and medically underserved areas, has always been and found to be a good recruitment tool for the community, and lowering the barriers of entry into our state from other states, and the legislature made some real steps forward on that. Making sure that we are in fact properly licensing people who need to be licensed. And I'll just give you an example of this that I worked on as executive counselor. We had a law that would require the licensing of certain mental health providers, but the board never promulgated the rules. So that licensing didn't happen. And the reason the licensing is so important is that certain insurances only pay for services that are provided by licensed providers. So the fact that we weren't issuing licenses for these social worker assistants and whatnot was prohibiting them from getting payment. And of course, if you increase payment, then it enables you to recruit and hire. In addition to that, we need to be working closely with our high schools, our community colleges, and our university system to make sure that we are actually matching up the workforce programs that they are, the training and education programs that they are offering with the needs of our, the workforce needs of our employers, and working closely with employers on apprenticeships programs. We've seen that around the state where, for instance, nursing certification programs are being offered by providers, and that translates into recruiting and retaining more employees. So there are a number of initiatives that we can and should be working on in the state to address and improve workforce.
So that's the workforce part of it, but is it concerning that so much of the state's medical provider grouping is falling to a few really large organizations that the several large hospital groups are controlling so much of the care in the state, or is that fine?
Oh, I'm sorry. Well, the question, I had addressed the question I thought was workforce.
Yeah, no, it's a good question to answer, but I think also I'm kind of wondering about the dynamic of
Yeah,
having
sure.
so few medical groups controlling so much of the state as well.
Yeah, I mean, we've seen the evolution of healthcare all across the country is the vertical integration of our healthcare system, so that community hospitals are more often tied to a tertiary provider of care, and from the community hospitals, they are often acquiring primary care practices and other practices. Some of this is driven by the pure economics of the situation, that primary care providers have found it difficult to sustain practices. And in order to ensure that we continue to have primary care in all of our rural areas, community hospitals have stepped up to acquire those practices. And in some cases, what's generating, the merger of a community hospital with a tertiary care hospital is the economics of that situation. And things like technology, the electronic medical records situation, and the many regulatory requirements that hospitals and medical providers have to comply with really have made it so that there are efficiencies in the system when they are merging. However, you strike on a really important point, and that is that we have to keep an eye on what having large healthcare systems in our states, what impact does that have ultimately on the delivery of care and on the cost of care? Because as you say, as they grow, we have to be careful that they don't become monopolies that can dictate higher prices. And that is part of the review process that takes place in every merger in our state, already in our state.
New Hampshire healthcare providers consistently challenge or criticize the state's Medicare, Medicaid reimbursement rates. Would you seek to raise them?
Well, I did, and I would say the state has control over Medicaid reimbursement rates, not the federal government controls the Medicare reimbursement rates. But I did actually work with Senator Sue Prentice on increasing Medicaid rates and with the department on increasing Medicaid rates across the board, which we did in this with the last legislative session, but in particular on emergency medical services, because we're just finding that those services are threatened everywhere across the state, and really creating some safety concerns. So we focused in on increasing those rates in a targeted way. Actually, we're able to increase the emergency medical services rates all the way from the Medicaid rate to the Medicare rate, which is quite a significant increase. And with the hopes of that is going to provide some stabilization in the emergency medical services realm. So yes, we're appropriate. Yes, we're going to make sure that we are providing reimbursement that will allow the services to continue to be sustained in our communities. It's just so critically important.
So how does the reimbursement get funded?
Right. So as I mentioned at the outset, we did that. We looked at that issue from the perspective of prioritizing, and that is what we have to do, and it's what everyone in our state does. They sit around their kitchen tables and they build a budget from the ground up, and that's what we will do in my administration.
Okay. I'm going to pivot to opioids. This spring, members of the addiction recovery community called on you to step down because of past work as a lobbyist for Purdue Pharma. How do you respond to that?
Yeah. I just want to say that at the outset that as someone who has a family member who currently struggles with an opioid addiction, and as someone who grew up as a child of an alcoholic, I have a very personal connection to this issue. I am a very visceral understanding of how addiction impacts a kid, how it impacts the entire family, and how it impacts the person who is actually addicted. And that is why, as an adult, this became the primary focus of all my volunteer activities, working to help other families that were affected in the way that mine was. I then served on the board of the Lakes Region Mental Health Center for 8 years. I chaired that board. I served on the board of Riverbend. I also served on 2 treatment center boards. I advocated to bring and was instrumental in bringing medication-assisted treatment to our state, and expanding options for treatment for substance use disorder. This is a problem that we absolutely have to tackle. The work that I did as an attorney in 2002 was 11 years before the opioid epidemic was declared here in New Hampshire. This is really a political hit job by my opponents to try and reach back 22 years ago. My commitment on this, in my work on this, has been decades long. And the real question we should be focused on is, who is it that can actually solve the problem of opioid addiction in our state? I don't think that the proposal that Kelly Ayotte is bringing forward, which focuses, it seems, on the law enforcement aspects of this, is a solution. And I don't think that my opponents in the Democratic primary has a demonstrated record of success on this issue. I offer to the state decades of experience and work in this area, bringing forward a program that focuses on prevention, harm reduction, treatment, and enforcement, a 4-legged stool. It's going to take a real concerted effort to do it, but I am the one who can offer a new way forward on this issue.
When we look at the numbers, this problem seems almost insurmountable. You know, what specifically is going to turn this around?
So treatment, let's start with prevention, right? One of the things that we've never done in this state is we've never truly integrated primary care and mental health care into our schools and into our primary care. We need to do that. And we need to be spotting kids who have suffered with adverse childhood events and getting and intervening early. The connection between an adverse childhood event and later substance use disorder is huge. And we need to make sure that we are intervening early. That's when we have our best chance of ever preventing that child from going on to having a later substance use disorder. Harm reduction. I've been a huge advocate of harm reduction for many, many years now. I know it's controversial sometimes and people find it sometimes uncomfortable, but harm reduction gives an addicted person another day to live and another day to have an opportunity to heal. And we need to lean in on that, treat people with the care and the compassion that they deserve. Prevention. This is another area in our state where we haven't really leaned in on having the kind of intensive outpatient programs that we need, the partial hospitalization programs that we need, transitional housing that we need. We really need to build out the continuum of care so that people have an opportunity to intervene earlier, and that we have an opportunity to intervene earlier in the process and hopefully get treatment to them earlier. Making sure that Suboxone is readily available and people can start treatment right away. One of the things that I've asked at the executive council meeting is often about emergency room physicians actually starting Suboxone treatment. Health and Human Services believes that that is happening, but what I'm hearing out in the field is it isn't happening. It isn't happening enough. And Suboxone treatment works. So getting, when we have somebody who's in crisis that ends up in an emergency room setting, if we can get them on to treatment and sooner, that will be helpful. And then building out those recovery centers that we need and providing people with the opportunity to actually be in recovery homes for the amount of time that they need in order to overcome their addiction and move on in their lives. And then finally, of course, enforcement. We need to make sure that we are adequately staffing our state police and our other law enforcement officials to be able to investigate and tackle this problem from a law enforcement perspective.
Thanks. My final question is on childcare, which, as you know, is a major issue for young families in this state. How do we lower childcare costs and still pay childcare workers the wage they deserve?
Yeah, so you strike on something that is absolutely perplexing about the whole industry, right? Is that if you are, let's just say you're a mom and you're going to go back to work and you're getting paid an average wage, and then you have to pay the childcare worker an average wage, it doesn't make economic sense, right? And so I do think, I first want to say that when I was in Keene, I think 2 or more years ago, I spotted the program that Hannah Grimes and that has been brought forth by Hannah Grimes, where they're offering, they saw the opportunity that moms who are at home, maybe stayed at home during COVID, did not return to the workforce, that they may actually want to do childcare in their homes. And so put together a program where those moms could receive a 7-week training course on how to operate a childcare business. The state trained on the regulations that would apply. They worked with the Keene State to provide child development training, and then worked with the charitable foundation to get funding to actually make the physical changes in their homes so that they could meet the licensing requirements. And that this program opened up about 60 slots for childcare in a very short period of time. I saw that program there. I was so impressed with it. I took it back to Concord and talked to the Department of Health and Human Services about it. And we are working that program to be piloted in other areas around the state right now. I think it's a real opportunity for, especially in our rural areas, to really expand in a pretty fast way, the availability of childcare, and get some moms, stay-at-home moms back working and into the workforce. Childcare across the board, I think ultimately the beneficiaries of childcare are businesses, right? Because they get the benefit of workforce coming back. So we need to be focused on talking to businesses and maybe even looking at some programs to incentivize businesses to assist in funding childcare for their employees, remembering that it's a relatively short period of time in the life of an employee that they actually need that full-time childcare. and that they ultimately are the beneficiaries of it. And we're seeing that around the state. We're really starting to see businesses recognize that if they are involved and engaged in childcare, they can actually, it can be a huge benefit in recruiting employees. So I think that is an area we really need to explore more.
Thank you.
Wait, can I just, well, I'll say one more thing. We're missing in our state a big part of the learning curve. We are in the minority of states right now that are not offering pre-K. And pre-K children learn on an exponential slope. We're missing a really important part of that slope. And, you know, to the extent we expand and are able, communities are able to offer pre-K, that takes a couple years off of the plate of a working family that's paying for childcare.
Can you please explain your plan for creating affordable housing? What steps should the state take in dealing with homelessness in the meantime or long term?
Okay, so you've appropriately, I think, tied the two together, right? The 60,000. We're 60,000 units behind by 2030 in the state right now, which is contributing to our homelessness crisis, the workforce shortage that we have, and the fact that so many of our young people can't afford to stay here in the state and raise their own families. There's not a single silver bullet to addressing the housing crisis. We need to make sure that we are pushing on every single lever and that we're focusing on this. Part of that is, well, I will just tell you, when the governor brought $100 million to the Executive Council for housing, it didn't have a word about affordable housing in there. I worked with all of the other counselors on this. They agreed with me, and we sent that back to the governor, put guardrails around that, with requiring it to be affordable housing, and we're building thousands of those units across the state right now. But the state is not going to build our way out of this. We need private developers to be building in our state right now. So I have met with developers all around the state and said, why aren't you building in our state right now? And the answer is almost universally zoning. So I'll give you some examples that they gave to me. If they have a project a piece of land that would accommodate 200 units, by the time they're finished with the zoning requirements, they're down to 93, and the project isn't economically viable for them anymore. Or they're willing to do, say, 40% affordable housing, the city wants 60, it's not economically viable for them anymore. Or in a rural area, they buy a 5-acre piece of land in a town that's zoned for 5 acres, so they can only put a single family home on it. They say they can't afford to put a starter home on that property. The only thing they can make money off of is a mansion. And so we need to tackle the zoning requirements. We need to give communities incentives to make the changes they need to accommodate the density of housing we need in our state. There are lots of proposals out there to do that. We already have money to help communities make that change. We already have money to help communities. A lot of our rural communities don't have the infrastructure, so they don't have the water and the sewer that they need to accommodate the density of housing that they need. So helping with that, we already have money in the Housing Champions program for that. We need to continue those efforts. We need to change the narrative around housing. Communities need to understand that the communities that build the housing first win. That's how you increase your tax base and bring families to your community, encourage businesses to your community. That's how we build vibrant economies. And this is not a not in my backyard situation. This is a situation where the people you're keeping out of your backyard are your kids and your grandkids and your teachers and your firefighters and your police officers. And so we really have to be changing the narrative. I think that we should be rewarding communities that will make the changes they need to accommodate the density of housing that we need. So economic development money should follow those communities that are making the changes that we need to make. Another area is surplus land. The state of New Hampshire, once it gets a hold of a piece of property, doesn't give it up easily. But a lot of times what I have found is that when I go looking for land for a specific project, and ask about specific pieces of land, it turns out they are surplus and we can get them back to either a nonprofit or to the community so that they can be used for housing. And I'm working on a project for this right now in Claremont. And we really need to make sure that we are getting that surplus land back out to the communities so that they can build on it. And I'll just say one more thing. It's going to take a wide array of things. Not one of these things is going to solve the problem. But the density, the accessory dwelling units. We need to make sure that we are encouraging and allowing the use of accessory dwelling units. We have a lot of folks who, in the ordinary sort of course of their lives right now, would be downsizing. You know, the kids are gone, they don't need that big house anymore. There's no place for them to go, but they may want to create an accessory dwelling unit in that home, and it will allow them to continue to pay their taxes and the overhead costs of their home, and also increase the density of housing in our state. So it's going to take a lot of approaches. It's going to take a lot of people sitting at the table. One of the frustrating things I found as an executive counselor when I went looking in state government for the person who's actually responsible in state government for monitoring how many housing units we have, how many we need, and how we're going to get there, is that person doesn't exist. And so, we need to make sure that somebody is minding the shop.
Okay. You advocate legalizing recreational marijuana. As a longtime person in the medical industry, how do you feel about studies indicating that doing so would increase use of cannabis by teenagers and young adults?
Yeah, I actually don't think that's what the studies are showing. I think that the studies are actually showing that when cannabis is legalized, that the black market for cannabis tends to dry up, and that teenage use of it has actually decreased in states where it is legalized. And I think that what I think most everyone has come to recognize now is that all of our neighboring states have legalized recreational cannabis use, and so that our residents are traveling across state lines to access this product that they, in my opinion, should be able to buy right here in our state. And those revenues should stay in our state.
Okay. Your website lists a pretty detailed energy policy. What's a big step the state can take right away on energy?
Well, we could accept the federal money that's available for establishing EV charging stations around the state. We, are leaving money on the table. We have fallen way behind our neighboring states on the development of EV charging stations. It's making us a bit of a donut hole, so that folks that have chosen to drive electronic vehicles would find it more difficult to come here, and their tourism dollars, aren't coming with them if they aren't coming here. So that is certainly an easy first step, is to take advantage of federal funding that is already available in that regard. Another would be the investment in energy efficiency in our state. This current administration is somewhat inexplicably hostile towards energy efficiency, and I think that we need to be using our regional greenhouse gas initiative funds for that effort. And also making it easier for communities and businesses to invest in the development of solar in renewable energy efforts. But solar, there are quite a number of projects out there that either businesses or communities want to develop. But because there has been a limitation on the megawatts, that hasn't been able to happen. I'll give you an example. There's a business right here near Concord. They have a 1 megawatt solar array on the roof of their building. It's decreasing their cost, and it's decreasing their reliance on energy off the grid. And they really need 4.5 megawatts in order to operate their business. but because of regulations in Concord, they're not able to do that right now. So we're actually stopping businesses that are looking to move to a cleaner energy economy from doing that, and that is nonsensical from my perspective.
We have among the highest student debt in the nation and the lowest state contribution to higher ed. What would you do differently?
So a lot of times at the executive council table, we'll hear a reference to, sometimes the governor will often say, well, we're an aging state. And we just like, as if we're going to accept that and just age out. Part of the problem here is that, we don't make it easy for our kids to stay here and get a higher education right here in the state. Kids can go out of state and pay out of state tuition in other states, and is less than what they will pay here in in-state tuition in New Hampshire. And of course, once we lose these kids to other states, it's not easy to get them back. So that it's just and we need to invest in our future generations and make sure we're keeping our young people here in our state. And so I absolutely support increased investment in higher education. And I particularly, want to support investment in our community colleges that offer a really low cost option for kids to get their first 2 years of college education and take on less debt in the second 2 years. And I'll tell you, as somebody who worked 30 hours a week to pay my way through college, I think what is remarkable about that is I was able to do that with some grants, a little bit of loan money, and get myself through college. I don't think a kid can do that today, working 30 hours a week. The cost has just gotten completely out of reach for our young people. And we need to make sure that we are investing in the next generation.
Would you change anything about the state's redistricting process?
Yes. Yes. We know that right now, in the last election, Democrats won the majority of votes cast for executive council, for Senate, and for House, and yet we hold majorities in none of them. And on the executive council, it's particularly distorted. 1 seat out of 5, when we actually took a majority, more than 50% of the votes in the state. We should have an independent redistricting commission in this state and make sure that everyone's vote counts and that it reflects the actual will of the people.
Cindy, I want to backtrack a little bit. Earlier, Rick had asked about housing, but he also asked about what the state's role would be in dealing with homeless or unhoused people. We've seen that, that's an issue that's come up in Concord, in Manchester, in Keene, other places. It seems to be at a kind of a peaking thing. What should the state be doing in terms of easing that situation or dealing with it?
Sure, working hand in hand, right, with our communities to make sure we address this. And we cannot separate the homeless, the unsheltered population's issues from the need for substance use disorder treatment and mental health treatment. And I can say this really definitively because if you look at what we have done on veterans, we have built out the housing with wraparound services. So I work pretty closely with the Coalition to End Homelessness here in Concord. And they tell me that within a couple of days, if they have a veteran who's in an encampment and wants to come into housing, we can get a roof over their heads with wraparound services in like 24 to 72 hours. And so we know, and we know that works by getting them in an environment where they have a roof over their heads, but also have the wraparound services they need that help them adapt and adjust so that they come off the streets and are successful in sustaining long-term housing. So that is the goal, to provide those services. And that, of course, means investing in the kind of case management programs that we need, the reach out. When I was talking about helping to find surplus land, it's a part of that is for a resource center. Here in Concord, we have a resource center that will, those that are unsheltered can come in. They can take a shower, they can get their mail, they can charge their phones, they can do their laundry, and they can access case management and get access to the services that they need, including mental health services and substance use disorder services. And all of that combined is how we are really going to tackle the problem, is getting both houses. We need more roofs over heads, right? We need to build, as we talked about with housing, but we also need to make sure that we're providing those wraparound services.
Okay, well,
If I could just, Bill, if I could just interject
Yeah.
a question. So one of the prominent initiatives under Governor Sununu has been the Lee Act Commission, which was addressing concerns about law enforcement accountability and related matters. So I wonder what your assessment would be of that initiative. How are we doing on it? What more needs to be done? And also, what's your view on how the state's doing on addressing the increasing diversity in the population?
I'm supportive, obviously, of the findings of the Lee Act Commission, and have been particularly interested in my time on the council about making sure that that has been integrated into our training at police standards and training, and actually stay in pretty close touch with the Commissioner of Safety about the implementation and the continued training of our law enforcement folks. As somebody who was on the board of the Mental Health Center and chaired that board in Laconia, we always made a real effort to be working closely with law enforcement to make sure that law enforcement had support they need, the kind of mental health support they need to deal with the kind of situations that they encounter in the field that their training had never really prepared them for. And the truth is that no matter how much of that training we do at police standards and training, it isn't going to be enough to accommodate all of the situations they encounter. And that's why we need law enforcement working hand in hand with the mental health community to make sure that we have that interaction when there are those kinds of crisis situations when we really need to bring mental health in to the picture. As far as the diversity, I am an advocate of expanding the diversity of law enforcement and of across the board, expanding diversity and making sure that we have every voice at the table, and that we also recognize bias where it exists. At every judicial hearing, for instance, I ask every nominee, what do you think a judge's role is in reducing or eliminating implicit bias from our judicial system, and raising awareness of that issue across the board, and continuing to make sure that we hear from all voices at the table.
Well, thank you for your time. I think we've about run the gamut here, and we certainly appreciate you chatting with us. And
thank you. I want to say what a pleasure it has been for me to serve Cheshire County during my time as executive council. I have certainly focused on many of the issues specific to Cheshire County. We've seen the flooding problems that have happened over the years now, 100-year floods happening every 2 years, wiping out communities, and have worked very hard to make sure that we from a state level are responding quickly to our communities. Also have worked in Cheshire County with respect to the crop loss programs that we saw with our farming community, that because of changes in climate, they experienced significant crop loss, 75% of our apples last year, 100% of our peaches last year, and that we need to really make sure that the crop loss insurance programs and the crop loss programs in our state are protecting our farms, because, you know, no farmers, no food. It's been my pleasure to focus in on the transportation issues that are specific to Cheshire County. For instance, finally getting funding for the Vilas Bridge, to have that bridge restored. It's in the 10-year plan, and that had been elusive for very many years. And also really starting to focus in on the transportation issues and lift up the transportation issues that are specific to Cheshire County. You know, for instance, I conducted a hearing when we did the transportation hearings in Keene, and had a young woman who does not drive because of a disability, who came forward and testified that it would actually take her 23 hours using public transportation to go from Keene to Portsmouth in our state. And really lifting up that issue, I took that issue to our transportation conference to raise that up. I am always an advocate for more public transportation in our state. And then I guess I'll just say finally, the broadband issues that are specific to Cheshire County. We have money that is once in a lifetime money to make sure we connect every possible location to broadband. And I've been making sure that that's happening in my district. And we were able to get a contract that covered a great number of locations in Cheshire County, including over 3,000 in Winchester and 400 in Alstead that might have never been covered if not for these efforts. So proud to have worked with Cheshire County and to make sure we're making government work for the people of our state.